Dr. Paul Hutchison.
Mr. Chairman, it's an absolute pleasure to be speaking on the Financial Reviews 2010-2011 because under this national government there has been some great gains in health which unfortunately the opposition spokesperson has just failed to notice. And of course the health targets are an absolute classic example of where they are. Firstly, let's have a look at the list. Immunisation, of course, has been an absolute gain of the highest order over the last 3 years. 3 years ago, under 2-year-olds, only 70% of them were immunised. Today, 92%, and we've almost got 95% being fully immunised. A huge achievement in health promotion, disease prevention. To add to that, the national government has instituted the rheumatic fever scheme, which again should have happened under the Labor government. All they did was talk about it for 9 years, but the national government has actually instituted this program. Mr. Speaker, 3-4 years ago, the average wait in emergency departments in this country was over 6 hours. Today, 92% of patients get through emergency departments in under 6 hours. DHBs like Waitemata, who under the Labor government, we heard stories of patients wallowing in the corridors for 24, 48 hours, have just recently reported that 90 to 95% of them get into the wards or get discharged in under 6 hours. Another tremendous achievement. Let's go to the issue of radiation therapy, which I vividly remember. Under the Labor government only 4 years ago, cancer patients were being sent to Australia because the waits in New Zealand were 3 months, 4 months, 5 months and 6 months, which was absolutely shocking. Today, we have the gold standard therapy where every radiation patient is being treated in under 4 weeks. Another tremendous achievement under this national government. And Mr. Speaker, we can go on. 89% of hospitalised smokers are given help in advance to quit. Now that's an incredible achievement. And we have Marion Street saying nothing's been done. This is the first government to put in year on year significant increases in tobacco tax, which we know is one of the most effective ways to diminish smoking in this country, and indeed it is working. But let's just have a look at some of the other achievements. 27,000 extra people are now getting elective surgery every year since the national government came into office 4 years ago. Another remarkable achievement. Mr. Speaker, we do know that health systems around the world are characterised by almost infinite demand and finite resources. And what we do know is that a Treasury study in 2006 showed no increase in productivity under the Labor government in the health sector, despite increasing the vote by billions of dollars. What we heard last night on TV, that over the last few years there's been an increase in productivity in the health sector, 5% year on year. Year on year. This was anticipation. This is an anticipation for the national government. And of course, great to hear that this finally is being carried on. Because after all, we heard in 1999 that the advice to the incoming health minister was that the greatest gains in health would come from health promotion, disease prevention and the integration of primary and secondary health, and nothing happened under that Labor government year on year other than spending more money. And we have absolutely established some great examples in immunisation, in the rheumatic fever, in the bowel prevention programs that are occurring, and much more.
Mr. Chairman.
Honourable Peter Dunn.
Mr. Chairman, can I thank those members who have contributed to the debate thus far? Can I acknowledge particularly the Chair of the Health